scrotal ultrasound. Before we go to the ultrasound of scrotum, testicles, and other structures in the scrotum, let's see the anatomy. Scrotum is skin covered pouch suspended outside the abdominal cavity. It contains the testes, epididymis, and lower part of the spermatic cord. Here we have a testicle. You can see it is in a pouch. The head of epididymis, body, and tail, and then is the spermatic cord. Whereas in this scan, we can see a fetal scrotum with two testicles and cut section of the penis. And here you can see the pouch in the amniotic fluid. The normal testicles appear homogeneous, wide, which are symmetrical bilaterally. They are homogeneously ovoid in shape. When we compare its echogenicity with the thyroid, thyroid is relatively hyperechoic. This is the right lobe, left lobe of thyroid with the isthmus and trachea here. These are the carotid vessels. Then here are the muscles of neck. And when we compare the echogenicity or echotexture of thyroid with testicles will be relatively hypoechoic. The layers of the scrotum includes from outer to inside various layers of scrotum around testicles, which include fat-free skin, tarsus muscle in the superficial fascia, external spermatic fascia, cremaster muscle in the cremasteric fascia, internal spermatic fascia. Then comes the three tunica layers, tunica vaginalis, tunica albuginea, tunica vasculosa, and then comes the testes. Here are these layers. You can see the skin, superficial fascia. Then we have the external spermatic fascia. This is the cremasteric muscle and fascia, internal spermatic fascia. So the cremasteric muscle is having a outer layer of fascia which is called external spermatic fascia, and the inner fascia is internal spermatic fascia. Then is the brighter layer of tunica vaginalis. Then is the visceral layer of tunica vaginalis, and inside of this blue line is the tunica albuginea of testes. This is the sinus of the epididymis. This is epididymis. All of this is the sinus. Here we have got ductus deferens in the cut section, rete testis, in mediastinum testis. These are the septas inside. Then we have this scrotal septum. And lobules of the testes, which are separated by septa. Tunica vaginalis is a serous sac having two layers, a visceral layer attached to the surface of the testes. This is the inner side. Visceral layer attached to the surface of the testes, and a partial layer attached to the scrotal wall on this side.